leg cramps. Causes, mechanisms, triggers, treatment, prevention, and deep explanations. Dear friends, welcome back to our channel. Today we're going to talk about a topic that affects millions of people around the world, leg cramps. These sudden, painful muscle spasms can appear out of nowhere, interrupt sleep, interfere with daily activities, and significantly affect quality of life. But the most important thing to understand is this. Leg cramps are never random. They always have underlying reasons. And if you understand why they happen, you can get rid of them much faster, and often permanently. So today, we'll go through this topic clearly, deeply, and step by step, so you finally understand what your body is trying to tell you.
What a leg cramp actually is. Deeper than my leg just throws. A cramp is not just a simple muscle contraction. It is a complete breakdown in the nerve-muscle communication system when the nerve sends an incorrect, overactive impulse. The muscle contracts suddenly and gets stuck. Blood vessels around it go into spasm. Circulation drops. Metabolic waste accumulates, and the muscle becomes unable to relax. During a cramp, muscle fibers literally lock in a shortened position. A cramp itself is not a disease. It is a symptom that something in the body is out of balance.
Why leg cramps often happen at night? Nighttime cramps are extremely common. There are three main reasons for this. 1. Drops in magnesium and calcium levels at night. These minerals shift into tissues, and available levels in the bloodstream decrease. 2. Slower circulation during sleep. Blood flow naturally slows down, meaning less oxygen and fewer minerals reach the muscles. 3. Sudden micromovements while turning in sleep. A small change in position can trigger a spasm in an already tense or depleted muscle. However, daytime cramps are also normal and can occur for many reasons.
The main cause? Magnesium deficiency expanded. Magnesium is the #1 mineral responsible for relaxation. It regulates muscle relaxation, nerve impulses, heart rhythm, vascular tone, electrolyte balance, and recovery after physical stress. When magnesium is low, muscles become overly excitable and spasm easily. Why magnesium deficiency is so common? Stress burns through magnesium 4 to 5 times faster. Coffee and tea drain magnesium stores. Sugar disrupts absorption. Diets and fasting reduce intake. Diuretics flush magnesium out of the body, and modern diets lack fresh greens and mineral-rich foods. This is why magnesium deficiency is now one of the most widespread deficiencies worldwide.
What about potassium? Potassium is essential for muscle contraction, while magnesium is essential for muscle relaxation. If potassium is normal or high, but magnesium is low, the muscle contracts but cannot fully relax, and a cramp occurs. That's why some people feel better after eating potassium-rich foods, while others feel worse. It depends on the overall mineral balance, kidney function, and sodium levels.
Why magnesium doesn't always help? Deep explanation. If magnesium supplements don't work, the reason is often one of the following. 1. Vitamin B12 or B-complex deficiency. Without enough B12, nerves become irritated and unstable. Their electrical signals become irregular, sending the wrong impulse to the muscle. This is especially common in people over 45, people with diabetes, long-term metformin users, people with stomach issues or low acidity, vegans, and people with restrictive diets. 2. Side effects of medications. Many medications can cause leg cramps as a side effect. Diuretics, blood pressure medications, statins, antidepressants, hormonal birth control, certain osteoporosis medications, certain asthma medications. If cramps began after starting a new medication, this may be the reason. 3. Excessive vitamin D and calcium, hypercalcemia. This is one of the biggest modern problems. Many people take vitamin D every day, for months or years, in high doses, often combined with calcium. This can lead to hypercalcemia, an excess of calcium in the blood. Hypercalcemia causes muscle tightness, joint pain, deep pressure like muscle pain, weakness, cramps, heart rhythm issues. Vitamin D and calcium must be taken only when needed and under supervision. 4. Dehydration and loss of electrolytes. When the body lacks fluid, blood thickens, sodium drops, magnesium and potassium become imbalanced. This is common in hot weather, workouts, or physical labor. 5. Thyroid issues. In hypothyroidism, metabolism slows down, magnesium is absorbed poorly, blood flow decreases, nerves become more sensitive. Cramps are very common in thyroid dysfunction. 6. Pregnancy. Pregnant women have increased blood volume, higher demand for magnesium, increased calcium needs for fetal growth, and more pressure on veins. This combination makes leg cramps extremely common during pregnancy.
Why mineral tests are often inaccurate. Magnesium in the blood represents only 1% of the body's total magnesium. 98% is inside cells, where tests don't measure it. That's why magnesium levels can look normal, but supplements still help. Or levels can look low while the person has no symptoms. The same applies to calcium. Total calcium can be normal, but ionized or active calcium may be abnormal. Blood tests are a tool, not absolute truth.
Leg cramps during physical activity. What actually happens? Cramps during or after activity happen due to buildup of lactic acid, microinflammation, loss of electrolytes, muscle overuse, poor recovery. This happens during long walks, heavy garden work, hiking in mountains, running, intense workouts. Recovery, hydration, and magnesium are key.
Spine problems and cramps, the real truth. A pinched nerve or herniated disc can cause shooting pain, electric shock sensations, tingling, numbness. These can feel like a cramp, but they are neurological pains, not muscle spasms. If your leg locks up at night, in 99% of cases, this is not a spine problem, but a mineral imbalance.
The role of diet. Why food triggers cramps. The body reacts differently depending on your personal metabolism. Some foods can reduce cramps. Leafy greens, almonds, avocados, bananas for some, pumpkin seeds, cacao, dried apricots. Others may trigger cramps. Sugar, salty food, coffee, energy drinks, alcohol, nightshades, tomatoes, potatoes, eggplants for sensitive people. Why? Because foods affect insulin, kidney function, mineral retention, blood acidity, hydration.
Varicose veins and flat feet. These conditions do not directly cause cramps, but they reduce circulation, increase heaviness, slow recovery, make muscles tired faster. Exercises for circulation and foot strength significantly improve symptoms.
How to stop a cramp fast. Advanced techniques. 1. Tension relaxation method. The fastest. Tighten the muscle hard for 5 to 7 seconds. Relax for 5 to 7 seconds. Repeat 5 to 10 times. works in 20 to 30 seconds for most people. 2. Calf stretch. Pull the toes toward yourself. 3. Deep massage. From heel to knee. 4. Hot shower or heating pad. 5. Contrast. From cold to warm. 6. Walking barefoot.
Why cramps come back months later? Because minerals fluctuate depending on diet, stress, hydration, seasons, medications, hormones, and sleep. Taking magnesium 2 to 3 times a year for 1 to 2 months is often enough to prevent recurrence. Final summary: how to get rid of leg cramps long-term. To eliminate leg cramps for good, the approach must be comprehensive. Restore magnesium levels. Do not overdose vitamin D. Monitor calcium. Stay hydrated. Support thyroid function. Review medications. Use stretching daily. Adjust nutrition. Reduce stress. Strengthen veins and circulation. Improve sleep quality. And recover properly after physical activity. Your body is incredibly intelligent. Leg cramps are not an accident. They are a message. When you understand the message, you can restore balance and live without pain. Thank you for watching. Take care of your body, and we'll see you in the next video.